All right. Good evening, everyone. Good evening, SBC USD family, SBC USD community, to our families, to our employees, staff, leaders, our partners from Loma Linda. Welcome tonight. Glad to have you. The purpose of tonight's town hall is to provide timely information about vaccines and vaccinations. I'll say that one more time. The purpose of tonight's town hall is to provide timely information about vaccines and vaccinations so that you may make informed decisions about your own personal health and safety or health and wellness. Next slide, please. But before we get into tonight's presentation, I want us to take a moment to think about everything that has gone on over the past 16, 18 months, the complexities, the barriers that we've overcome as a district, as a community, as a city. And I want us to focus on or reflect on two basics. The top basic, number one, focus on results together, and then parameters of trust. And I'll say this. We've been able to produce exemplary outcomes in this community. Given everything that's gone on, we've overcome a lot. And that's because we've been working collaboratively, our families, our employees, our partners, and that's evident. And then finally, as we work together, those parameters of trust are becoming more and more realized and solidified for us. So I want to thank you tonight as we move forward to continue with that reflective mindset, focusing on results together and our parameters of trust. Next slide, please. And so as we transition on in our evening, I wanted to take a moment to welcome those who are with us, our partners tonight. I want to welcome you on YouTube. I want to welcome you here who joined us through our Zoom. Thank you for being here tonight. Thank you for your continued dedication and your commitment to the district. I want to thank our Board of Education, our board members who've been leading the charge with health and wellness and health and safety since all of this began. I want to thank our cabinet, starting with Mr. Doc Irvin as well, and all of cabinet for their tireless efforts. I want to thank our educators out there and our leaders for doing such a wonderful, excellent job during this time, moving things forward for our scholars and families. And I also want to thank our family members who might be joining us tonight. We know that your support has been very, very evident and welcome, and we thank you for that. And I want to take a moment to thank our Loma Linda University partners and Dr. Juan Carlos Belliard and his team for agreeing to be here tonight and talk through some of the complexities around vaccines and vaccinations and what we can expect as we move forward. So I'll take a moment, I'll turn it over to Dr. Belliard, who may have a few words before we continue. Thank you, sir.
Thank you, Dr. Funches, and thank you to all our partners at the San Bernardino City Unified School District. One thing that we've learned during the pandemic is that partnerships are extremely important, especially in a time of crisis. A time of crisis is not the time to create new partnerships necessarily, but to really lean on the existing deep relationships that we have, and we really appreciate that ongoing partnership that we have with our district. Just a disclaimer of what I was telling Dr. Funches earlier. You've invited public health and pharmacy healthcare professionals, and we might seem a little bit biased because based on what we know about COVID-19, the virus, the disease, and what we know about the vaccines that are available to us, we do tend to lean in one direction, and that's the direction that we've seen has given the best results for the population. And I think that's something important to consider. I think the biggest challenge as a society is what do we consider as individuals versus what is the best for the entire population. And this is speaking from a public health perspective, right? Which considers the entire community. So I know by this time into this pandemic, a lot of us have made up our minds, but we're here to provide information and answer questions, and we hope to do it in a way that's respectful and in a way that is informative to all of you. So I think next, Dr. Funches, I don't know if you want to take it from here.
Yeah, and I'll come back. Thank you, Dr. Belliard. Thank you for your words. And as Dr. Belliard stated, health professionals will provide information from their experiences and perspectives. From a district standpoint, we're making sure that we provide the most current information around vaccines and vaccinations so that you can make informed decisions as employees, as community members, as family members throughout our district and throughout our community. Next slide, please. And so I'd like to introduce our panel. And if you didn't know, we have simultaneous presentations going on. One in English. I'd like to welcome Dr. Jody Gonzalez here, and then Marcus Funches, myself. I'll be on hand to support the moderation and answer any questions that we might have from a district standpoint. So welcome, Dr. Jody Gonzalez. On the Spanish side, there was a link to a Spanish presentation as well. Dr. Lizette Stoletny from the School of Cardiology, Dr. Ubaldo Soto as well, and our own Mr. Luis Chavez is on the other side providing any information from a district standpoint. So wanted to point that out. Next slide. And so 2 objectives for tonight. Like I stated earlier, provide information to educators and families regarding vaccinations, right? Vaccines and vaccinations, just giving the most updated, timely information so that you can make the best decisions for yourselves and your family members. And then our other intent is to answer any questions that you may have about vaccines, vaccinations, or anything that you've heard or anything that you have some curiosity about. So without further ado, next slide, please. So there are 2 ways that we'll be able to answer some of your questions. So what you see in front of you now is a number that you may text during the presentation. If you text that number, we're able to capture some of those questions. And by the end of the presentation, we'll go through those questions and provide answers tonight. Now, I'd like to remind you, we have received some questions already, questions that were forwarded to us using a link that we provided before the actual presentation. So we have those questions, and there'll be an opportunity for you to text any questions. And then we also may have time for those who are here with us to raise their hand and unmute using your Zoom buttons, for lack of a better word, so that we can take your live questions as well. So those are the ways that we'll take the questions and answer those questions tonight. So moving on, next slide, please. So at this time, I'm going to turn it over to Dr. Jody Gonzalez from Loma Linda University School of Pharmacy, who will present to us some information around vaccines and vaccinations. And then we'll, at the end of that piece, we'll come back for the question and answers. Thank you, Dr. Gonzalez.
Good evening, everyone. Hope you guys are all doing well. Over the next couple of slides, I'm just going to provide you with some updates on COVID-19 vaccines. I know in the past week, there have been many changes. So I'll describe a little bit about how COVID-19 is currently affecting our community, and then we'll jump into kind of what the vaccine recommendations are now, so you can figure out what you would like to do in the future. So next slide. So COVID-19 infection that we're currently experiencing in the United States is the Delta variant. In comparison to the Alpha variant, which first arrived here, this one spreads much faster, and that's why we have seen this rapid spread throughout the United States. And it can cause more severe cases than other variants, specifically the Alpha one, specifically in those people who are unvaccinated. Those people who are vaccinated oftentimes show, if they do have a breakthrough infection, their symptoms do last for a shorter period of time. But the bright side of this is that the vaccines have been proven to significantly reduce the risk for hospitalization in those who are vaccinated who do obtain Delta. Next slide. So there are currently 3 types of COVID-19 vaccines, and I'll discuss them a little bit over the next couple of slides. The 2 main types, there's 2 platforms, one mRNA and the other one is a viral vector. So mRNA generally in the body gives our body the instructions of how to make certain proteins. In the case of the mRNA used for COVID-19 vaccines, the mRNA that is in the vaccine gives the instruction for the spike protein. The spike protein in the COVID-19 virus is the part that allows the virus to enter the cell. So if we give someone the mRNA, the instructions to make the spike protein, we're essentially priming the body to make antibodies to that. Once the antibodies are there, if we were to get the infection, we already have the antibodies to whatever spike protein that comes from the coronavirus. The Janssen or the viral vector, instead of using mRNA, it has an inactivated virus. It's an adenovirus, and it's the adenovirus is usually for the common colds, but it's not active. Once in that is also the mRNA instructions of how to make the spike protein. So again, once we get the injection, our body has instructions on how to make the spike protein. We make the spike protein in our bodies. We have antibodies now to COVID-19 and its variants. So that's kind of how those 3 vaccines work. Both of these vaccines, once the spike protein is made, they are degraded in the body, so they do not alter your DNA in any regards, and then the viral vector does not stay in your body. Next slide. So the first, the Pfizer-BioNTech COVID-19 vaccine is actually the only one that is currently FDA approved for anyone over 16 years and older. Currently, there is a transition from the one which got approved under emergency use authorization. And the way emergency use authorization works is generally if we need a medication for a specific time period very urgently, that's why it goes under emergency use authorization, and then it goes under FDA approval because we need something in that time to treat people because of the severity of the infection on the community and people's health in general. So the Pfizer-BioNTech COVID-19 for ages 12 to 15 is still under emergency use authorization. But if you're accepting it for 16 years and over, it is FDA approved. They are the same exact vaccine. One has just been FDA approved because they look at all the evidence for safety and efficacy. And the hopes is that soon the one for 12 to 15 will follow the same pathway. When you're looking at efficacy against the Alpha variant, it is 95%. It's 88% effective for the Delta variant, and then it still does have very significant efficacy against hospitalization, and that's basically what we want. We don't want to end up in the hospital from this virus. And there's 2 doses and they're 21 days apart. So oftentimes I may get questions, what happens if I'm after I got my first dose and then it's 21 days, it's past 21 days, maybe 30, 40 days later, you can still get the vaccine. You do not have to restart the series. You'll just get the second dose and you can complete the series. Next slide. So the Moderna COVID-19 vaccine is still under emergency use authorization for individuals 18 years and over. This one has an efficacy of 94%. They don't have any peer review data specifically in regards to efficacy against Delta, but it has shown to be efficacious against Delta as well as hospitalizations. And then it's a 2-dose series, 28 days apart. Again, if for any reason you're past that 28-day mark, they can still give you the vaccine and you do not have to repeat the whole series. Next slide. The Janssen COVID-19 vaccine is under emergency use authorization for individuals 18 years and older. It has a lower efficacy of 67% compared to the other ones. There's a couple of reasons why that could be. One, we were looking at the alpha variant initially when they did all the clinical trials for the Pfizer and Moderna. There were more variants by the time they did the Janssen one, so that could have contributed to the lower efficacy. However, it does reduce the risk for infection, and it does reduce the risk for hospitalization from the infection. And it's a 1-dose series. So some people just like to get 1 dose and kind of move on with their day, and they don't have to worry about coming back for anything. Next slide. So the vaccine adverse reactions generally only occur 1 to 3 days after the vaccine happens, and then they should go away within 1 to 3 days. Generally, if the adverse reactions last longer than that, we generally recommend that you see your doctor. When you're looking at the more common side effects, injection site pain, swelling, redness, similar to any other injection. And then usually for fatigue, you'll experience fatigue, headache, malaise, tiredness, a slight fever. Usually it happens on the 2nd dose. However, we have seen it happen to people in the 1st dose. It just kind of depends. Usually the symptoms last, I would say for most patients, about a day. Some people up to 3 days, but usually at that 24-hour mark, I don't know what it is, people just report that they feel significantly better. Serious adverse reactions, there have been cases of severe allergic reactions, but not as many as we initially anticipated. There has been reports of myocarditis for the Pfizer and the Moderna vaccine. And generally, specifically in children who are younger, so the 12 to 29-year-old and specifically the males. There's increased risk for blood clots and low platelets with the Janssen vaccine, particularly in women less than 50 years old. So generally, we'll have the women kind of talk to their doctor to kind of see what's best. And then Guillain-Barré syndrome with the Janssen. And Guillain-Barré is a neurological condition that can happen with some vaccines. If you have a history of Guillain-Barré syndrome with any other vaccines, I would recommend that you talk to your healthcare provider to see which vaccine would be the safest for you. Next slide. So the benefits of the vaccine. So I think the biggest benefit that we see is to prevent serious illness and hospitalization from COVID-19 infections. The less people that we have in the hospital, the less resources that are on the hospital, and the better care that we can give to all the patients who need to be in the hospital. It offers protection to those who are unable to get vaccinated. And it helps attain herd immunity sooner. The sooner that we can all obtain herd immunity, the quicker we can all go back to living our, what we say as our old normal, I guess you can say. And there's 2 ways to obtain herd immunity. 1, everyone can get the infection. And then 2, they can get the vaccines. Obviously, if we get the vaccines, we can get herd immunity a lot quicker than if we would wait for everyone to actually get the virus. Next slide. So who should receive the vaccine? Currently, the recommendation is anyone 12 years and older. There are very few people who can't get the vaccine. So anyone who had a severe allergic reaction after a previous dose or a component to the COVID-19 vaccine. So if for any reason after their 1st dose, they needed an epinephrine pen, they needed hives, those would be the people that we wouldn't recommend it for. Anyone who had an immediate allergic reaction. So these are more of the hives to any of the vaccine or any component of the vaccine. And generally, this has been pretty low when we have been administering COVID-19 vaccines to the community. Next slide. So this is all the new information. So last week, or in the most recent weeks, there was a third dose for COVID-19 vaccines. And these are for individuals with a moderate to severely compromised immune system. So a lot of people, if you take any corticosteroids, if you take any of the medications for rheumatoid arthritis, if you have HIV, this is definitely, you may consider getting a third dose. And also anyone with organ transplants or anyone with cancer. So all these individuals need to get a third dose. They're recommending that they get a third dose because these are the people that they have found to be hospitalized in recent months. They've found that the third dose for this population is like the equivalent of everyone's second dose. So we get, for this population, that third dose reaches the same immunity that we wanted for everyone else. So all these people are now eligible to receive a third dose. Most of the pharmacies and the locations that were offering Pfizer or Moderna vaccines are offering this third dose to any of their patients. Generally, it's recommended to receive it 28 days after their second dose. And for some people, if it's been a while since they got their second dose, feel free, they still would need their third dose. So I would go in and get it. Next slide. So booster doses. So booster doses of COVID-19 vaccines are recommended because as time has progressed, they've seen the level of immunity against COVID-19 has shown to increase. With that, that's why we're seeing a lot of breakthrough infections for people who got the vaccine maybe in early January or December. So specifically for those who received the Pfizer-BioNTech vaccine at least 6 months ago, these people have been studied and been shown to have waning immunity. They're still doing studies on the Moderna vaccine to see if a booster is needed for that, as well as for the Janssen vaccine. So the people who should receive a booster are those ages 65 years and older, residents in long-term care settings, so a lot of the skilled nursing facilities, and then people age 50 to 64 with underlying medical conditions. Underlying medical conditions are those conditions that would generally make the symptoms worse if they would get a COVID-19 infection. So anyone with any chronic kidney disease, diabetes, COPD, asthma, hypertension, these are individuals who they are recommending to get a booster dose. Next slide. And then this group of people are individuals who may get a booster dose of COVID-19. Usually these individuals probably have to weigh the risk versus benefits of getting the vaccine, but oftentimes these people are most likely to be exposed by COVID-19 and probably have waning immunity. So they're generally recommending that they could get them. So people ages 18 to 49 with underlying medical conditions. So the same conditions that I mentioned earlier, chronic kidney disease, diabetes, hypertension. And then people aged 18 to 64 who are at increased risk for COVID exposure or transmission because of their occupation or institutional settings. So a lot of first responders, healthcare workers, grocery store workers, public transit workers, correction workers. So if you fall under any of these categories, you are now eligible for a booster dose. And again, the same sites will be offering these as well. Next slide. So I just put a list of common questions that I get when I'm working at any of these COVID-19 vaccine injection sites. So what happens if a person has a COVID-19 infection? Can they receive the vaccine? Generally, we wait till their acute illness is over and they no longer have to self-isolate and it is fair to administer. Before we were having them wait the 90-day period, and that was more because of the shortage of the vaccine at that time period. But then they haven't figured out like when a person actually loses their antibodies. Normally, they were saying that it lasts about 3 months. So that's kind of where the 90 days came from as well. When should I receive a vaccine if they had a COVID-19 exposure? Once the patient is out of quarantine, they're fair to get the COVID-19 vaccine. And then right now, I think this is a question we're getting a lot. What happens if they get a flu vaccine or another vaccine? What kind of do they do? Previously, there were recommendations to separate them. Now the recommendation is that they can be given at the same time. We don't have to wait a 2-week period to get it. So if you're due for your flu vaccine and you're due for your COVID-19 vaccine, you can get it on the same day. You can get it a couple of days later, whatever works for you. I think some people, it just may be hard if they get the COVID-19 vaccine and the flu vaccine. They may not know where the symptoms are coming from. So if you really want to see kind of how you're reacting to the COVID-19 vaccine, I would probably recommend that you get it separately. And any questions now?
Well, I actually thank you very much, Dr. Gonzalez. Great presentation. We didn't go into, I had a quick question for you before we go into some of the audience questions. Tell us a little bit about the work that you do at Loma Linda. What do you teach at the School of Pharmacy? And yeah, a little background about yourself.
Okay, so I'm one of the assistant professors for the School of Pharmacy. So with that, I spend half of my time teaching. I teach endocrine and geriatrics. I also train our students on how to give immunizations. And then part of my other position is to work with patients managing their medications for chronic diseases like diabetes, hypertension, COPD, asthma. And then my other hat that I wear is with the COVID-19 vaccine clinics and just in general, the flu vaccines across campus. So I was one of the clinical leads for vaccinating our institution. And then I was one of the clinical leads for the mass vaccine efforts that we had at the Drayson Center at Loma Linda. So I have been very involved in vaccinating individuals, answering any questions they may have, seeing I've even not only given the vaccine, I've drawn up the vaccine, I've staffed the observation area. And currently right now, I will take part in the administration of COVID-19 vaccines for boosters as well.
Wonderful. And thank you for your service. I know those months between January and May were very busy months. 1,500 to 2,000 people a day coming through the mass vaccination clinic. So I know everyone, including yourself, were very busy. One of the questions that we got ahead of time was this question about women and their reproductive systems and concerns about the vaccine interfering with reproduction. Could you comment on that, please?
So I know they've looked at that as well. There have been shown that the vaccines don't affect reproduction in any way. I know they were concerned that the spike protein and the antibodies that were created could potentially attach to the placenta. However, that hasn't shown to be true, although it does have some similarities into the same antibodies. There is enough difference that it doesn't do that. And they have looked at another thing about reproduction. There have been multiple women who have gotten pregnant either during the study or after receiving the COVID-19 vaccine. So it hasn't affected their fertility in that regards.
Well, thank you. Another very common question that we have here in our list is natural immunity. Can you comment on that? And I think natural immunity can come from, just eating healthy, staying healthy, keeping a healthy body. And also the immunity, if I can just add, that comes from having had COVID in the past. If I've had COVID, do I still need the vaccine if I have some of that immunity that came with having the virus?
Okay, so first, in response to kind of an active lifestyle and eating healthy, I think, well, it does keep your immune system good to fight off infections. Unfortunately, with this COVID-19 vaccine, it doesn't truly affect people in the same way. Oftentimes, we think that people who are healthy and are eating right, they will be okay. But we've heard countless stories of people who have no underlying medical conditions, but that still have severe disease. So unfortunately, I think the only way to do this is to give the vaccine. And that's why we're recommending the vaccine, just so that people can have that immunity already. And then in response to the immunity from the actual virus, so We know that it lasts at least 90 days. We don't know how long it lasts after that. Generally, we know you have immunity to that, whatever variant that you had before, but we don't know how strong you will respond to the Delta variant. Oftentimes, we have people who have developed a secondary case of COVID, maybe a couple months later or a year later. So, although it works, although it may offer you some immunity, I think that the best bet would be just to get the vaccine, because that has been shown to probably provide the best immunity at this time.
Thank you, Dr. Gonzalez. We'll go back to the questions, the questions. We do have a hand raised. Ms. Marquez, please unmute and then we can answer your question.
Hi, I'm Christina Marquez. I'm a member of the community as well as a teacher within the district. And I'd like to open with first thanking Loma Linda University for opening up the vaccine to the educators of our county before our regular healthcare providers did. Now, my question today is, will you have the boosters available to us the way that you had the vaccines initially available to us, where we went down to Loma Linda and got in line and got our shots?
I don't know, Dr. Balliard, do you know anything? I know we have some clinics, but I don't know who.
Sure.
I've heard, but I don't know if Dr. Balliard knows a little bit more.
Thank you.
Yeah. So we will not have the mass vaccination site like we did earlier at the Drayson Center, but we do have a team that goes out to different entities. We're booking appointments on a weekly basis, so we're happy to work with our partners in the community to bring the vaccine to you, actually. So it would be easier and a shorter line the way we're doing it now.
That's wonderful. Thank you for all you've done for us. We really appreciate it, especially those of us working with elementary students who are not yet able to get a vaccine. Thank you.
It's our pleasure, Ms. Marquez.
Thank you.
And Dr. Belliard, we can go back to the other questions.
Okay, great. There was a question that came through about a mother and daughter who received the vaccine a couple months ago, and they feel like they've been experiencing bone pain ever since. Is that pain related to the vaccine? Is it going to go away? The question was posted there. The daughter and the mother are feeling this pain in their bones.
So I was looking into it a little bit. I haven't seen anything or heard of anything. I think what my recommendation would be is to visit your doctor just to ensure that if you think it was related to the vaccine, file a report with VAERS. So in case they start seeing more of these, they can look into it. That's kind of what happened with the reproduction and the menstruation. Enough people reported it, and I think they're doing studies now to look at it more closely. Anything that you get, Be Safe is an excellent application to use after you get the vaccine that checks in on you. If you have any side effects, I would check VAERS and then just visit the doctor to kind of see what the correlation could be, if there was one, or is it unfortunately just a coincidence with the vaccine and the symptoms.
And we take these things very seriously. I think that's great advice to check in with your primary care physician and to report this. If there are enough cases that are similar, then it's definitely something to look into. But then on the other hand, things happen to people. And just because you had the vaccine doesn't mean that there's a correlation between what happened to the individual and the vaccine. Your slide about adverse effects actually is connected to this next question, which is, there are so many adverse effects. Why are the vaccines being made mandatory? Why are they mandatory when there's so many side effects or adverse side effects?
I think when they look at that, I think there's a couple of things, right? They look at the risk versus benefits. And overall, most of these adverse effects are self-limiting. It would be generally like a really bad, like if you have fever, you have headaches, malaise, and I think it just varies depending on the person. So I think because they go away in 1 to 3 days, as opposed to COVID-19 vaccines, we don't generally know kind of what a person's response would be. They could be sick for a couple of days, they could be sick for weeks, and they could even potentially end up in the hospital with trouble breathing. So I think that's why it's a little bit more mandatory now, and as well as Dr. Balliard mentioned earlier, for the population as a whole, if we do our part to help get everyone that we can vaccinated, then the people who cannot get vaccinated, like the children, we can protect them from this virus as well.
And I know that in a country like ours that values freedom, sometimes these conversations are very difficult. But we need to also look at our daily lives and how every day we decide to give up some freedom for the safety of others. And I think the example we use in public health is we don't have the freedom to board a plane wearing a gun. We couldn't, because that would not be safe for the people on that plane. So we give up that freedom of carrying a gun on a plane for the safety of the collective group. So thank you for answering. And then the last question that we received ahead of time was really, after having been vaccinated, where and how do we submit proof of vaccination if we need to show that?
So how you do that? So generally, you have the vaccine card. That's one way. Generally, we have people make to just take a picture of it. However, there is actually a website where you can actually get a QR code, and I could look it up. I don't know it off the top of my head, and I could send it to Dr. Balliard, where you enter all your information through California. They have a registry, and you have the QR code, and you just have to show that QR code anywhere you go. So that's one way. Another way, what's nice is because everything's being entered into a registry, whenever you go to your primary care provider, they also have that information. But I think the QR code is the easiest because you can save it to your phone and you have it with you wherever you go, and you don't have to worry about that little card. You can keep the card at home and just have the QR code.
And Dr. Belliard and Dr. Gonzalez, if I can weigh in here, if that's any SBC USD employees, we are developing, or we've worked with the county, San Bernardino County schools, and they've created a system where once we begin to upload documentation or evidence or verification of vaccination, we'll be able to do it through our BestNet system, meaning we have a pay system that we use in the district, and we can click on and see our available leave banks and things like that. That same system we'll be able to use to upload verification, which will be housed very confidentially in human resources. So you'll hear a little bit more about that in the coming days. Thank you.
Excellent. So we will open it up now for questions from the audience.
Let me hit a couple more of those pre-questions, okay. Then we'll go back there. So there was a question that has to do with our scholars, and we have Dr. Rodriguez here that can weigh in on that question. So I'll read it. What kind of outreach are the schools and district doing to track students who are absent and not reporting COVID symptoms or positive test results?
That's a great question. And thank you for being here today, for those people in the audience. The district is really taking a concerted effort to recover students who are absent from school. And so our attendance verifiers at the school sites, as well as the district, are making phone calls and home visits as necessary to find out why students are not there. Many times, if we're unable to reach a parent, we're able to go to the home, talk to a neighbor to get more information about why the student is out ill. And we've been very, we've met with a lot of cooperation from our families when they have situations that may be COVID related. In regards to the second question about what are we doing to track students who may not be reporting COVID symptoms or a positive test result, that's something that's a little more difficult to answer. With all transparency, we can only go by what the parents are reporting to us as far as why their student is out sick. in just kind of doing some observation, it's very hard to disguise symptoms of COVID. So if someone is at school and they're exhibiting symptoms, they are, their teachers are on the lookout to find out, to monitor if students are coughing or sneezing or, just, kind of acting out of the norm. We do have COVID liaisons at our school sites that are able to then talk with the student, talk to the family, and get more information about that student's health. On a personal note, having relatives in the district, children, scholars who attend our schools, I have been personally affected where we have students who may have been infected and then exposed others. And so just speaking from, experience, the district is taking it very seriously, where, I have 3 nieces and nephews that go to school in our district. They've all been quarantined on different occasions, as well as their parents who are also district employees. So COVID is no joke. We take it very seriously, and we always err on the side of caution because we know that health is wealth, and we want to make sure that we're protecting our scholars and their families from this really ravaging illness that we're experiencing at this time. So great question. And we're doing our best to make sure that we're keeping our kids safe. Thank you.
Thank you, Dr. Rodriguez, for the follow-up answers to that very important question. Dr. Belliard, Dr. Gonzalez, I had one more that I think you might be able to answer before we open it up. Will San Bernardino County force a vaccine on children in order to attend in-person learning? So it's more of a county question. Will the county force a vaccine on children? So you can weigh in there, and maybe we'll weigh in with what we know as a district.
Yeah, I'm happy to respond to that. The county will follow the CDPH, the California Department of Public Health advisory. So it's possible that there can be a mandate for children going to school once the vaccine becomes available for those ages. Right now, like Dr. Gonzalez mentioned, only Pfizer is available to children 16 years or older. We're waiting for the, and for 12 and above is UAE. But, as the vaccines become available to younger children, this could be a vaccine like other vaccines that are required for any children to attend school, like MMR or some of the other vaccines that we're more used to.
Thank you, Dr. Belliard. I won't weigh in there. I think that was answer was sufficient enough. Those who are with us on the call here, might you want to unmute and or raise your hand and ask any other questions before we begin? It's 6:14 now, so we have time to answer a few more questions or more questions that you might have.
Dr. Fuentes, we do have a comment in the chat. I can read it out loud from Brittany.
Okay.
It says, I have not received the COVID vaccine and have not contracted COVID, thankfully, but I have had a couple of colds within the past year, testing negative both times, and feel confident about not getting the COVID vaccine. If the vaccines are not 100% effective against the virus, and even many people, especially celebrities, have contracted COVID even after taking the vaccine, why is it still being pushed on us if we should be doing what's best for ourselves? The vaccine is supposed to protect the individual, and I feel confident not taking it. Also, my children have had adverse reactions to vaccines, which make me question their risk of having adverse reaction to the COVID vaccine.
I'll jump in here, and then maybe Dr. Belliard and Dr. Gonzalez from your perspective. And I will say this from a district standpoint, we do respect our employees and our staff's right to choose and make their own choices about their health and wellness and the health and wellness of their family and their children. So I will say that it is a personal choice. Our goal or our intent is to provide as much information as possible so that you can make that informed choice there. And so for any follow-ups, Dr. Gonzalez, Dr. Belliard, anything there?
Dr. Gonzalez, did you want to take a shot at this
Yeah.
one?
I'll take a shot at this one. I think again, like Dr. Belliard said, it's more for the collective whole. We want to provide the more vaccine, the more people that get vaccinated, the quicker we can obtain herd immunity and protect others. I think when we get back, we can get COVID-19 and nothing would happen to us. But I think we have to think sometimes if we could potentially have it and be asymptomatic or unknowingly spread it to other people, other children, or parents, grandparents, anyone with like an immunocompromised condition. That's why it's being pushed a little bit more, because we can unknowingly spread it and other people can get COVID-19 and it can be serious for them.
And I just wanted to add to your comment, Dr. Gonzalez. This virus has been such a Russian roulette. I mean, it acts in very strange ways. I know people who have gotten the virus within a household, and other members who live with them and interact with them have not gotten it. And then others who maybe just went out one time to the grocery store will get it. So it's very hard to predict. The other thing I would like to add is that the variants exist in unvaccinated populations. So until we reach that herd immunity and limit the ability for that virus to find a host, we're going to continue having variants. The Delta variant is not the last variant. There's new variants already appearing, and it is looking at the collective good versus the individual in this case. But thanks for an excellent question.
Thank you. Thanks for the response as well. Any other of our participants tonight? Mr. Miguel Villalobos, want to unmute, please, and ask your question?
Yes, thank you. So I understand the vaccination, that its goal is to reach that herd immunity, but being part of the CSEA, I've heard a lot of comments from concerned employees regarding the vaccine, because they've seen the adverse effects that were mentioned earlier. So one of the things that was mentioned earlier in the town hall just a moment ago was that the goal is to reach herd immunity, and herd immunity can be attained by the vaccine or previous infection. So one of the things that some of the members are concerned about is that they're concerned about the vaccine itself, but they have had previous infections. So they're asking if they had a previous infection, wouldn't that be enough of antibodies in their system to be able to protect them as well? And I understand that earlier there was a comment made that there's not been enough studies, I would assume, or enough information on how long those antibodies stay in the body. But wouldn't it be similar in the vaccine, that there's not enough information on how long the effects of that are also as well? And again, it's just because there's some members that are concerned about the vaccine.
Thank you for your question. Dr. Gonzalez, Dr. Belliard, can take a shot at that one.
Yeah, I can answer that one. And then Dr. Belliard, if he wants to add to it. Thanks for your question. So with the COVID-19 vaccines, obviously, we're giving them at a more, as we're administering the vaccine, we can test people for antibodies a little bit earlier. And just like with the individuals who are getting the vaccine, they're showing waning immunity. When they did studies on individuals with previous COVID-19 infection, they also showed waning immunity. It's just a little bit harder to distinguish, because oftentimes someone may have COVID-19, but they're not, they're asymptomatic. So we truly don't know as much as we did with the people who received the vaccine. Dr. Belliard?
Yeah, no, I think that's a good response. The other is, I know that there's been comparisons of the immunity from getting COVID versus the vaccine, and the vaccine does seem to prove a stronger protection than the natural immunity that would come from contracting the virus. I think the other thing is looking at risk, right? Risk is fascinating to study. Epidemiologists study this all the time. We look at relative risk, and we take risks every morning, right? When we get up, there's a risk of leaving the home, risk of getting on the freeway. That's probably one of our biggest risks that we take every day, is just driving on the freeway. But there's old risk and there's new risk. And I think the new risk is always a little bit more concerning because it's unfamiliar. For somebody who has never flown before, I think getting on an airplane is terrifying, or can be terrifying, but it's a lot safer than driving on the freeway, but that might be something that you're used to. So I think that that's what we're experiencing now. There's a lot of kind of sociology that is going on with this pandemic, and we're learning a lot about human behavior, obviously. But I just wanted to say that the risks that we're taking, we're constantly weighing what is a riskier route. And when we compare getting COVID and what has the amount of mortality and morbidity that getting the disease versus any kind of adverse effects from the vaccine, the evidence is really weighing on the side of the vaccine. Now, again, that's in a collective way, not necessarily just individually.
Thank you for that. Don't see any more hands raised at this time, but there was one question about employees that I'd like to answer before we go back to any other questions that one may have. So how can employees be safe when parents are still sending their kids to school sick? And I'll answer it like this. So the district, we are communicating to our community about the importance of keeping their children at home when not feeling well or ill or displaying any symptoms. And we'll continue to do that. We'll continue to make sure that we're communicating that expectation out. But on the other side, in terms of safety, the mitigation strategies that we've put in place, for example, the masking, wearing masks, indoors, the HEPA filters, HEPA units that purify the air frequently, as well as hand sanitizing. Those things, when being done properly, help keep us away or keep employees away from potential exposure or positive cases themselves. So we'll continue to make sure that we provide that expectation, communicate that to our parents, while our employees continue to do what we need them to do and what we all should be doing in terms of the mitigation strategies that we've continued to implement and enforce. So thank you for that question. We'll keep at it. We'll keep learning, we'll keep growing, and we'll keep communicating out. So thank you for that question. Let me look back over here there's one in the chat. If you want to read that one, Selena, at all?
Of course. We have, if a vaccinated person can still get COVID but show less symptoms or be asymptomatic due to the vaccine, wouldn't they be more likely to spread the virus than someone who isn't vaccinated and probably has more symptoms and would know they are sick and stay home? You're on mute, Dr. Gonzalez.
Okay, there you go. So with people, more with the Alpha, and then they've showed this a little bit with the Delta, but the viral loads for anyone who had received the Alpha was so low that they weren't able to transmit it to people. So if they were asymptomatic, they had it, but they weren't able. With Delta, they're showing higher viral loads. However, not as their viral load isn't as high as someone who was unvaccinated. So while they may be asymptomatic, they may have a higher viral load, but I think again, For most people, if we're out and about, if we wear our mask, if we hand wash, we should still be able to protect those people as well. So anyone like outside of your household, I would just recommend wearing a mask, just so that even if you do have a higher viral load with the vaccine, that you won't be spreading it to others. So I think it's a twofold. The vaccines work and then masks work. So together, we can severely decrease the rates of infection. Dr. Belliard?
No, I'm so glad this issue of masks has come up because it's such a simple public health intervention. Some of the things that have saved the most lives in the world. One example is ORT, oral rehydration therapy, has saved more babies from diarrheal diseases than anything, and it's a very simple solution that people in developing countries can make themselves and give to their babies. I think the mask is another wonderful public health intervention. It does prevent people from spreading, and it also protects people from getting those viral viral transmission. So I think every variant is going to be different, and we have to keep adjusting to the different variants that we're going to keep getting. So this virus is here to stay. I believe it's not going to go away, unfortunately. I hate to share that news, but we need to be able to pivot and to adjust to each variant and hopefully protect the majority of our population. So when you go out into public, if you're indoors especially, please wear your mask.
Thank you. Thank you, Dr. Gonzalez. Thank you, Dr. Belliard, for those responses. Any other questions as we begin to wind down here? We want to thank our participants tonight for coming on and listening to our presentation and receiving that information and also having questions. We'll give it a moment. I don't see any hands.
I'm sorry. Can I make a comment without raising my hand? Reginald Woods. I'm sorry.
Oh, yes, sir.
Okay, how are you? My question is this. Some of the people that are more astute or more studied come up with all these different philosophies of why the vaccine is not good. Why does the medical community not talk about the people that have died from the vaccine more, to be able to put that out there? That's what I'm hearing. I think I've heard that enough to think that's really valid. Because when you don't put those extremes out there, if the people in the community who think that stuff is being hidden from them, which emboldens them not to, they're thinking like, they're gaming us, they're trying to seduce the masses, and they're holding back some truths, like we know people die from the vaccine. Why does not the medical community put all the horror stories out there to basically say, we're being very as transparent as possible? Yes, people die from the vaccine. I don't really hear that. Could someone address that, please?
I don't know, Dr. Ballard, if you want to answer that first. I don't
Sure.
have anything off the top of my head.
I have colleagues who work in the medical center, who are in the ICU, who work in infectious diseases, and I think the reason, Dr. Woods, that's a great question. I think sometimes the reasons we don't show or we don't talk about the horrors of what we've seen in the hospital, because I have mentioned this in other presentations, that until you start seeing the body bags coming out of the ICU, you really don't understand the magnitude of this pandemic. I think some of us, for whatever reason, have been spared to some degree, but I don't think any of us have been spared from losing somebody that we at least knew. And I think maybe the reason we try, sometimes we shy away from kind of the vivid horrors of what we've seen, is that people feel like it's being sensationalistic at some points. And until you see it, you really don't believe it. But I've talked to some of our recent nursing graduates. These are 22-year-olds who have had to be with dying patients, who've had to help carry the bodies out, and who would go home wondering if they could really do nursing. This is not what they really signed up for. to see that level of death on a daily basis. So, you know, we have attendings who have been away from their families for weeks and weeks at a time. Just, you know, I know a friend who had a trailer in his driveway, and who would just, you know, stay in his trailer, and his wife would bring him food out there, and he didn't see his family for a while, especially at the beginning of the pandemic when there's so much uncertainty. But yes, I think we have seen the deaths. I've just recently, just this summer, I lost two friends. One who was a colleague of mine who sang in the choir with me, and he was actually on a AARP commercial as a healthy senior citizen. He was in his early 70s, but he was the picture of health, and did not feel like he needed the vaccine because, hey, they've done commercials about me. I'm healthy. I exercise every day. I would see him at the Drayson Center early mornings. He was there at 6 a.m. every morning, and he would have me take videos of him doing chin-ups, so he could send to these folks that wanted to do more commercials about him. We lost him about 3 weeks ago. He got sick. He got COVID. Ended up in the hospital, and before you knew it, his funeral was last Sunday. Another colleague of mine who is a marathon runner passed this summer. Very healthy. So I think until we do see those horror stories, Dr. Woods, you're right, and it's a delicate line. You know, do we just focus on that? But I think for people who have lost loved ones, this is a very serious issue. The other thing I've seen a lot is family members of the deceased will then sign up to get their vaccines, or people who got very sick when they finally made the appointment to get their vaccine, but were, you know, a week too late. So thank you for that question, that comment.
If I may dig a little deeper though, because there have been people who have died from the actual vaccine shot. I mean, you know, I've worked with you through different organizations, and I'm a proponent for the vaccination and testing and masks, the whole 9 yards. But I get caught off guard when I know a person, I'm in this group, and all of a sudden he says, my wife got the vaccination and died from the vaccination. And of course, there's complications that are beyond my thinking of what that's for. But because the medical community doesn't put that out there, it gives more arsenal to the communities of the people who are skeptical of the vaccination, because, like, you know what, we know people are dying from the vaccination, but you're talking about a little arm soreness and a little headaches, but you're not saying that people are dying from getting the vaccination. So I'm just kind of asking. I'm just more curious than anything. I'm trying to, you know, you do this professionally, your community, your expertise, and your colleagues. That's what I'm getting to more so.
And sorry for misunderstanding your question. So people dying from the vaccination. From what I've read, I have heard of people that have died after getting the vaccine, but the association, was it because of the vaccine, or was it that they already had COVID when they got the vaccine and died? That's what's not clear. So I'm not aware of numbers of people dying from the vaccination that has been proven to be associated with the vaccine. I don't know if Dr. Gonzalez can comment on that.
Yeah, I think that's kind of where I was thinking. I think it's hard, even if someone didn't have COVID and unfortunately they did pass shortly after they received the vaccine. It's kind of hard to know if the vaccine truly caused that. I think if there was a significant amount of death that could be related to the vaccine, I think that's why it's really important to do the VAERS. An example of the Janssen vaccine, when they stopped it or they paused it due to the blood clots, that's kind of an example of, if there was a greater risk overall, they would pause the vaccines and definitely reevaluate it. I think it's hard to see if the vaccine truly caused the death.
Thank you for the responses to the questions by Dr. Woods. There is a comment in the chat by Mrs. Rufus, Autumn Rufus.
Actually, it's a question, but
Question, gotcha.
yeah, if it's so dangerous, why are we still in school? I have family members who are on a borrowed kidney, and they can't afford. They're in the hospital now, trying to survive, and yet, why are we back in the school if we can still, especially with the children who can choose, their families can choose not to get the vaccine. Like other vaccines, they have to show proof that they did before they can come to campuses. And then we also have children who are too young to get the vaccine. So this is very concerning for us teachers who are with these kids every day. Putting them at risk, putting us at risk. It just seems, I would just like the answer, I guess. Sorry, thanks.
So the school question, I think, is an important one. And appreciate it, Ms. Rufus. Again, it's looking at the population. So early on, there's two things. One was the social burden of having kids in school, especially in populations where the parents are having to go to work and the kids cannot, stay home with somebody. I know of people who have had to decide either I work or I stay home, but I can't afford a sitter. So I think there's that social burden that plays into the equation. Also, what we've noticed in the last year is that children don't seem to carry the same or be as contagious or bring the virus home as much as adults do. So there does seem to, this has been a virus that has been a little kinder to children earlier on. Delta variant has definitely been a different story. It's been affecting younger people and kids. But I think it's also weighing the benefits and the risks. So it's a very difficult, I think, decision. I'm glad I'm not the one having to make those. But I think as a society, we've also seen the impact that not having kids in school has had on a lot of our communities.
And I think, again, masks are really important. Make sure you're wearing your mask. Make sure the students are wearing the mask. I think even I've been in situations where I've potentially been exposed. As an educator, we did bring the students back. And I think it's for the students, we've seen it does benefit them, but there is still a risk to everyone involved. So I just make sure I wear my mask. Really reinforce that if anyone shows any signs of sickness, just please stay home. But the masks have even worked, even by themselves. So
Thank you, Autumn, for that question. And thank you.
Dr. Funches. Hi, my camera is not working right now, so I apologize for that. But I also did want to make sure that I shared for those who are viewing, because I know it was answered in the chat, but
Right.
I do want to make sure that for those who are viewing, everybody is aware that in the state of California, the executive order that allowed schools, public schools, to offer distance learning as the primary mode of education expired this year or over the summer, and it has not been renewed. So we do not have the option as public schools in the state of California to offer primarily distance learning. We did make a virtual academy available to families who had specific concerns, but there are some specific requirements around how that plays out in our district as well. I just wanted to make sure that people understand that that decision is a state decision and not necessarily a local district decision.
Thank you, Ginger. Thank you, Ms. Ontiveros, for that follow-up as well.
I did want to comment on something. I was on a call this morning with author, one of my favorite authors of Last Child in the Woods, his first book about the nature deficit disorder and how our kids need more contact with nature, and that would solve a lot of our ADHD issues in our society, which I completely agree with. One of the things that came up in that discussion in his presentation, his name is Richard Louv, I'll put it in the chat, was schools looking into more outdoor education, and that's something that hopefully the state can look at. We live in a state where most of the year we have very good weather, and I know this is way outside of my league here, but there are models of where Finland, for example, where kids are outdoors a lot more and learning in the outdoors. So I think this pandemic has maybe provided an opportunity to explore that a little bit more as well.
Thank you, sir. Thank you for following up with that as well as we continue to wind down here. I know we've answered the pre-questions. We've taken some questions from raised hands, and we've allowed some follow-ups as well. So we're going to look around and see if might there be any more raised hands before we begin to wrap up here for the evening. Once again, I want to thank you for joining us this evening for information session on vaccines, vaccinations, and Q&A as well, so that you can continue to make informed decisions about your own health and wellness, your family's health and wellness, and just having general information. So,
Dr. Funches, we have Miguel Villalobos with his hand up.
Mr. Villalobos.
Yeah, thank you. Sorry. Just one last question that has come up too with our members is the vaccine. What is the what's the protection on with the variants? And also, do you guys foresee the boosters being a requirement?
So in regards to the variants, there haven't been too many trials besides looking at the Pfizer. The other ones aren't peer reviewed. They've generally been somewhere between 60 to 80%. They have been in the 90s for hospitalization. So I think hospitalization is the thing that we don't want to have anyone have. I think the transition to the hospital and the hospital stays are generally what are most severe for patients. Most people can recover at home, even if it's just a mild illness. In regards to the boosters, we don't know yet. I think right now everything's just May unless they recommend that you should have it. And again, I don't know, Dr. Valliard, I don't know if you know how this goes. I think ultimately it will come down from CDPH, I would imagine, just like the current recommendations.
Yeah, that's correct. Just one more thing about hospitalizations. Hospitalizations are bad just because you don't want to be in the ICU, and the risk of dying once you're in the hospital is much greater. But the other thing we need to consider is that once our ICUs are full, people are going to die not just from COVID, but from other illnesses and things because they're not able to get the care that they needed. So what these epidemics and pandemics do, and this happened with Ebola in Africa, a lot of people were dying from non-Ebola related diseases because they couldn't get the care that they needed. So that's why it's so critical that we're not in a situation again where our ICUs are overflowing and we're not able to take care of the patient with a heart attack or kidney failure, et cetera.
Thank you very much. We're going to take a moment to make sure that and thank you, Mr. Villalobos, for the question. I want to thank our partners from Loma Linda University Hospital. Dr. Valliard, thank you, sir. Dr. Gonzalez, thank you for being here presenting the information. And on the other side with our Spanish presentation, I want to thank Dr. Stoletny and also Dr. Soto as well. Job well done. And for those of you who are watching tonight, thank you for joining us via YouTube. This presentation will be posted. You have access to it, but it'll be posted on our district website as well, so that you can go back and review and get answers or review some of the information that was provided. And the Spanish version will also do that. Our communications department does such a fabulous job with sharing that information. Thank you, Ms. Maria Garcia, for supporting this, Ginger Ontiveros Beatrice Gonzalez, as well as her team, Selena, here as well tonight. I want to thank our employees for being on, our union partners as well, and all of you that have joined us being participants tonight in this. This is an important topic, and we'll continue to learn and grow together. We'll continue to get information. We'll continue to make sure that we provide that information and updates. So I want to thank you once again. And everyone have a great evening. Be safe. Love on your loved ones, your family members, your colleagues. And as we continue to fight and get through this very challenging time, let's support one another. From San Bernardino City Unified School District, we thank you and have a good evening.